Hi, I'm Dr. Rocco C. Piazza, and I'm so happy that you're here with us this evening. I am a board-certified plastic surgeon at the Piazza Center in Austin, Texas, and we're standing in the middle of our skin bar. In this space, we create customized skincare regimens and help you plan your annual skincare program to exceed your expectations when it comes to the best skin health possible. I'm really excited because tonight we're focused on 2 proprietary combination treatments using the most advanced technology in the industry. We're focused on our Trilogy, which is Forever Young BBL or BBL Plus technologies, as well as fractional laser resurfacing using Cyton's Erbium platform and Contour TRL microlaser peel. With these 3 treatments, we can remove sun damage from the skin, we can help you resurface and create a smooth texture, and overall give your skin a brand new reset moving forward in the next decade. In addition, we're going to talk about the Fusion, which is an additional treatment. Not only is it BBL to help reverse sun damage, it's Contour TRL microlaser peel to help reset the surface of the skin and get rid of those deep, hard to lose or hard to erase wrinkles, as well as fractional resurfacing, which is the gift that keeps on giving for years to come, as one of the very best ways for us to reset textural changes and help to increase collagen production in your skin. But in addition, we're going to talk about how profound dermal treatment can really help enhance the lower face and neck shape and help to tighten skin of this area. It's equivalent to 37% of an outcome when it comes to looking at a surgical facelift. We're going to go through all of that today with you and more, and we're so excited to be hosting this. As always, I'll be doing this with April Daniel, our nurse practitioner who has over 15 years in dermatology and plastic surgery. April and I love hosting these events together and can't wait for the Q&A. So stay tuned. As we move through our program today, we're going to have some time to go through all of your questions, which will be done live at the end of this presentation. So stay online, create your questions, type them in the Q&A text box, and we'll be so happy to go over these with you today. Thank you for attending our virtual webinar.
Hi, my name is April Daniel. I'm the nurse practitioner here at the Piazza Center, and today we're going to be talking about advanced laser options that we offer here in the office. So advanced laser options at the Piazza Center include a combination of treatments. That includes Erbium total resurfacing, fractional laser treatment, microlaser pills, Forever Young BBLs, and Profound RF. Okay, so a common question we get is what is the advantage of doing these combination treatments? And the answer to that is that we have very powerful modalities that we can use to get the best anti-aging outcomes. These outcomes can include treating things such as acne scarring, deep and fine wrinkles. If you have any texture issues, it works excellent for that as well. And any sun damage. If we're trying to reverse signs of aging, these combination of treatments works wonders. By doing these combination treatments all at one time, you essentially have one downtime instead of multiple treatments that you have to come back and recover from each individually. We love doing combination therapy because you get the best bang for your buck, and also we're treating all the different layers of skin. So Contour TRL is made by Cyton. It is a full-field laser resurfacing treatment. It treats the complete epidermis and then part of the dermis as well. So what is the difference between CO2 and Contour TRL? The Contour TRL it's a newer technology that it's more customizable for the patient. It has less side effects and less downtimes for better results. So perfractional laser basically puts little tiny microscopic holes into the skin to help form collagen from the inside out. That helps with acne scarring, it helps with wrinkle reduction, and it also helps produce some tightening as well. So the next question is, what is Profound RF? Profound is a microneedling and radiofrequency treatment in one. What it does is it helps with tightening of the skin. A common places that we treat is the lower face and this neck laxity that a lot of people don't like. So here at the Piazza Center, we have created our own customized treatment options. One of these is called Trilogy, and the other one is called Fusion. So our first package that we offered is called Trilogy. That includes the Contour TRL, the perfractional laser, and then sometimes we also do the micro laser peel and a series of BBLs. Our fusion treatment includes all of those treatments, but we also add on the Profound RF. So there's a reason why we brought on some of these advanced laser treatments with SciTime. We've been using this machine for several years now. We've been doing BBLs and halos and we've had amazing outcomes with it. However, we want to be able to offer something that's more aggressive for those that are looking for a little bit more wrinkle reduction, some more tightening, maybe some more acne treatment scars, and we're able to offer that and get the best possible outcomes with these advanced lasers that we have. So we're able to treat face, neck, and body with these advanced laser options. So some of the best candidates that we use this advanced laser options for are people that maybe have tried other options and haven't gotten the results that they were looking for, people that have more deeper scars that are looking for more rejuvenation, or maybe even more rhytids or deep wrinkles that aren't being treated as aggressively with other options out there. So patients will start seeing results even within that first month as they start to heal, but really this is for the long haul. We start seeing maximum results. We check you at about 3 months. We'll see you again at 6, but true collagen remodeling can take all the way up to a year. Since this is a more aggressive laser, you can expect downtime for up to 2 weeks.
Thank you very much for attending this virtual event with us this evening. We were so happy that you chose to spend this time to learn about the advanced laser services and technology at the Piazza Center. Stay tuned because we're going to move into our live Q&A next, and April and I are available to answer any questions that you may have. In addition, we'll present special pricing on both the Trilogy and Fusion laser experiences at our practice. We're really excited that you're here, and I want you to know you'll receive a text from us just after this presentation, and we want you to say yes. This will allow our team to reach out to you and schedule a consultation so we can take a deep dive into your skin health, and the goals that you have in the next 12 months. Thank you again, and we look forward to seeing you shortly. Hi. Hello, everybody. Thank you so much for attending our event. April should be joining us shortly. We're so glad that you're here, and we hope that the talk was informative. And now we want to kind of dive into some questions. I'm joined by April Daniel, nurse practitioner, experience in dermatology, and our chief safety officer at PIATSA. April and I both have advanced laser training using Cyton Erbium platforms, which is primarily what we're showing you today. And we'd like to go ahead and get started just by answering some questions. I know it can be a bit confusing, but what we're primarily talking about are resurfacing treatments. And resurfacing treatments such as fractional and Contour TRL. Fractional means that it's a fractionated treatment, not the entire surface of the skin is completely ablated or removed. In Contour TRL, we are removing the entire surface, and these different types of treatments can be used to achieve different types of objectives or goals. And in addition to that, we are also combining these two treatments at the same time that we're performing profound radiofrequency magnetism to tighten the skin in the face. So to kind of answer some questions, one of the questions that I posed specifically or asked was about the difference between this type of laser, the Cyton Erbium platform, dual laser, and a CO2 laser, and then also what is how does the radio frequency or profound compare to virtue? So we did a lot of research on technologies, and Erbium is the most advanced technology when it comes to surfacing the skin. The reason for that is that it uses less energy than traditional CO2, which is the very first type of platform created and utilized for skin resurfacing to remove deep wrinkles, fine lines, and pigmentation. The challenge is CO2 uses a lot more energy, creates a lot more heat in the skin. When you create a lot of heat in the skin, you're essentially creating a very bad burn. And you can't always predict the outcome. So traditionally, some of the adverse outcomes from CO2 were complete hypopigmentation, loss of the skin, burns that were too deep, meaning that this laser created too much damage and led to unwanted scarring, which would be very difficult to treat. So Erbium provided a new way to resurface the skin using less energy, creating less heat, having a very predictable outcome that could be tailored incredibly well, so you can be super precise. And that allows us to be effective at our job, right? The less things we have to worry about when it comes to unpredictability, the better it is. We like things to be as predictable as possible. So that's the difference between CO2 and Erbium. Now, with regards to Virtue RF, I don't know this device. I saw this question come through and I went online and looked at it.
Dr. Piazza, I don't mean to interrupt you, but I think people are having a hard time hearing you.
Oh, can you hear me?
Better. Much
okay.
Better.
And I'm like in the same position.
That's okay.
Is this better now?
Much better. Yes.
Okay. So do I need to repeat any of that about Erbium versus CO2?
It might not hurt to.
All right. So yes, please. I gotcha. Okay. So can you hear me now?
Yes.
Everybody? Okay, great. Okay, so back to Erbium. So Erbium versus CO2, the reason why we use Erbium is the most advanced laser technology. The reason why we like it is that it uses less energy and has a very predictable outcome or very predictable healing results and timeline. CO2 is an old technology, and it was very good when it was first introduced into the marketplace in clinical experience for resurfacing, but the challenge with that is that it used a lot more heat and created a lot more heat in the skin. The problem with that is that more heat in the skin leads to unpredictable healing and can lead to unwanted scarring. It can lead to complete hypopigmentation or loss of the melanocytes. That can be bad because if you have just a very normal tone to your skin and then your face is really white because there's no more pigment in it, that's a problem. And it became a very classic look from CO2 resurfaced individuals. So Erbium allows us to be very precise. It allows us to use less energy. It allows us to have a very predictable healing experience for you. And it does a very effective job at treating fine lines, wrinkles, texture, pore size, etc. So that's a little bit about the platforms. Now there's a question about radio frequency devices. The type of radio frequency device we utilize to tighten skin is essentially the Profound device. Profound allows us to do two things. If we're using the dermal treatment, we can generate heat in the deep layers of the skin to cause tightening by collagen and elastin production of the lower face and neck and other areas of the body, fronts of thighs, inner thighs, arms, etc. It also allows us to treat the subcutaneous tissue with a different application of this radiofrequency energy, and that allows us to melt fat permanently. The Virtue device, which I looked up online, has very little information about it, including no published studies from what I could find on their website, which I thought was strange. So I don't know the device. The two big players in the marketplace with radiofrequency microneedling are Profound and Morpheus 8. Any other device has not made it past my desk because there's not enough research for us to even look at it. The reason why we chose Profound radiofrequency is because the clinical papers published about the safety and efficacy of this device surpass any device in the industry. And our clinic is firm on the idea that we only bring in technology that is the very best for our patients. So with that being said, I hope that opens up a little bit of discussion about these types of devices. I'm going to jump into some questions here and let April answer these. And I think one of the questions we have up next is, is this treatment using laser resurfacing, whether it's profractional or Contour TL, something that both men and women can utilize?
Absolutely. We do men and women in our practice. I think the biggest thing, with women, sometimes it tends to be, we see people that are really, really concerned about the area around their mouth. This is an area, especially I feel that women, we age a lot, so we can really target these lipstick lines, and even this lower face. Men also have issues as well. I think theirs tend to be, deeper lines across the forehead. We also deal with acne scarring. So yes, we treat men and women for all of these treatments.
There's a second question that kind of follows up on this is what's the age that the treatment is most effective? And I think this depends on the problem that we're treating specifically. Deep lines and wrinkles around the mouth, the most effective treatment to treat those lines is with Contour TRL resurfacing, okay? But that doesn't necessarily mean somebody in their 20s or 30s may need that at that time. Those lines tend to form after years of environmental damage as we move through the years and the decades. And so that treatment may be better in someone who has those lines present, which could be somebody in their late 40s, their 50s, their 60s, their 70s. So that's a great area to treat and a great age group. But we're really creating a clinical endpoint and the right type of criteria in the starting place. So with regards to somebody who's younger, somebody who's in their 20s with deep acne scarring, profractional resurfacing is one of the very best treatments that we have to release that deep scar tissue, rebuild collagen in the skin, and create a smoother complexion. And it usually takes more than one treatment, but it is the most effective treatment. So as far as age, it depends on the problem. Do you agree with that, April?
Absolutely, because we've seen people from all ranges, 20s to 70s.
We have a question about how many treatments are needed. And I think this really comes back to the idea that it depends on what we're treating. So if we're treating deep lines, wrinkles, etc., usually one treatment of a deep laser resurfacing is sufficient to yield a really successful positive outcome. Now, if those lines are being created by lines of animation, muscles of animation, so the frown lines, forehead lines, those types of things, that is treated with using neurotoxin to help decrease the recurrence of those lines. But we can absolutely eradicate them with deep laser resurfacing. So most commonly we would tell a patient, do you need to do this every year with deep laser resurfacing? The answer is no. It depends on when those changes come back. But with good skincare routine, retinol, having forever young BBLs on a regular basis, usually one treatment per decade is plenty. And you wouldn't necessarily need to have a treatment every year like you would with Halo. And that's a segue to one of our other questions, which is how does this type of laser resurfacing, profractional and Contour TRL, how does it compare to Halo, April?
So this is obviously a more aggressive treatment than Halo. Halo, you have a couple days of downtime and a few, up to a week of kind of a sandpapery feel, but you can go back to work. This is a more aggressive type treatment. So your downtime is going to be a little bit longer with this. I mean, we can expect those, especially that first week, we're really trying to keep that face hydrated so you kind of have a glossy look about you. There's good post instructions, and the patient has very much of a participation at home in terms of cleaning and taking care of the skin after this treatment. So I would say the average is probably a couple weeks of some downtime with this procedure, which is a little bit more than what Halo is.
Yeah, and I really tell patients, Halo is like a 2 to 5 day social downtime. If you did your treatment on a Monday, you could be at a black tie event on Saturday, and that wouldn't be a problem, and you would look amazing. But when it comes to deep laser resurfacing, this is really a 10 to 14, closer to a 14 social day, 14-day social downtime, right? So it take a lot more time. And the reason for that is that we are being more aggressive with our treatment. We are really deeply resurfacing the skin. Halo is hybrid fractional, so it's fractionated like profractional, okay? But it has a secondary component that causes heat in the deep layers of the dermis, and that's the non-ablative portion. And so it is one that allows you to have a very awesome change to the skin, but it's not going to remove or erase really deep lines with one treatment. Typically, that would require at least 2 treatments in a 12-month period. And so when you add up the time, let's say 2 5-day spans, that's 10 days of social downtime with 2 Halo treatments, you could have done 1 deep laser resurfacing and had a really effective result at getting rid of deep lines and wrinkles and had about the same amount of downtime. So I hope that answers some question. Fractional is a little bit different because it's a fractionated treatment really focused primarily on a couple things. One is eyelid tightening, lower and upper eyelid tightening non-surgically, as well as acne scar removal and other scars in the body. We use fractional to resurface thick scars, wide scars, stretch marks. The downtime from this is just about 3 to 4 days. It's actually pretty short. For the eyelids, it's longer. It's like 7 to 10 days. Why? Because the skin is so much thinner, and because we are fairly aggressive with our treatment. We want the best tightening possible, and so we're going to treat those super effectively to give you an outstanding outcome. So I hope that answers some questions about downtime. There's a question about whether or not we use numbing cream during these procedures, and the answer is yes. Depends on what we're doing. So a lot of times, if we are doing just profound radiofrequency microneedling, which we've talked about before, for tightening of the skin in the lower face and neck, we will typically inject the skin with a little bit of numbing medication. In a situation where we're doing deep laser resurfacing, we like to offer our patients a couple options. One option is to do IV sedation. IV sedation is the best way to undergo this procedure because it makes you the most comfortable, and it makes the procedure seem very fast. And that is nice. We want you to have a great experience. So when we do that, we would give you some medication through your IV by our board-certified anesthesiologist, Dr. Melissa Cady, who is present for the entire procedure. She's got you on a cardiac monitor, and she's placed an IV in your wrist or arm, and she's monitoring blood pressure, heart rate, all that stuff, and she's giving you medicine to make you very comfortable. And we call this twilight sedation. And at the same time, April or I will then inject the face to provide face blocks, right? So we're using numbing medication to very carefully block the nerves of the face. So you have a really great experience, and we're able to effectively treat your skin to an endpoint, a clinical endpoint that it's the reason why you came to see us. So we love the idea of IV sedation. For patients who are having a light micro laser peel, that's where we go very superficial in the skin of the face. Oftentimes, we will prescribe or use a medication that's sublingual that will help you to be very relaxed. You do need a driver with both of those experiences. We will use topical numbing medication on the skin as well. And it could be a way that you can do this without having to have IV sedation. So those are a few options. April, can you think of anything else?
No, I think it's very specific to the patient. So, some people are like, I just want to be out. I just want you to do your thing. I want to wake up and, feel great afterwards. And then other people don't want to go through that. And so we have to talk through that and see what's the best option for you. And it's also specific to which one of these procedures that we're doing too. So we have lots of options.
And we like to customize these treatments as much as possible when trying to plan what the best approach is for you. A question I have is about spacing between Trilogy surfaces or even fusion. And what we may not have made super clear is that these things are all done simultaneously. So we're a clinic focused primarily on doing multiple treatments at the same time. So you have one downtime. And that allows us to get a really clinically effective result. So for the Trilogy, which is profractional, It's using BBL. BBL is typically done before and after, as well as using Contour TRL. So this can all be done in the same setting. Now, BBL is sold as a series in this package because we want you to have pre and post treatment in preparation for optimizing your skin for the procedure, but then also making sure we really boost collagen and elastin production over the coming 9 to 12 months. So that's how we utilize it. It's really a phenomenal treatment. Broadband light is the best when it comes to reversing sun damage. So the reason why we package these into 2 different packages is that we like to do them in one setting. We can treat your lower eyelids, your upper eyelids, do a micro laser peel to the whole face, address the deep lines around the mouth, address the deep lines that sometimes form at the sides of the eyes or the cheeks, and do all of that in one setting. So you have one downtime. Fusion is exactly the same thing, except at the same time, we're going to use Profound for the lower face and neck treatment. And all of that happens in one setting, in one experience. So your recovery, instead of having 3 separate recoveries, one for Profractional, one for Profound, and one for Contour TRL, is all done at one time. I hope that clarifies that order.
But we will, just to preface, I mean, you know, to add on to that, we see you multiple times. This is not like, let me just treat you and we send you on your way. You're going to see us more than you probably ever even wanted to see our faces, because we're going to follow you after. You know, you're coming in the office, we're making sure that you're doing your post-care at home, we're taking photos along the way. So you see us probably more than you want, which is a good thing. It's not just, we're just going to treat you and come back and see us in 6 months.
Yeah, so we actually see you. This is a part of our annual skincare programming, which means that we do a Visia scan to get started. We identify the key areas of concern that you have with your skin, and we look at them objectively by our Visia skin analysis. So it tells us a lot about pore size, UV damage, textural changes, redness in the skin, and from there we customize the treatment. So that's kind of follows up on a question like, you know, what do you do if someone's on a budget? What option would you suggest that we start with when looking at advanced laser resurfacing? Well, it depends on what we're trying to achieve with your skin. And we work within budgets every single day. So what we do is sit down and prioritize what your biggest concerns are. And then we set up what the very best treatment plan is. And then from there, we work with your budget and figure out, okay, where are you going to get the biggest bang for your buck? What's going to be the most effective treatment for you in order to achieve your desired goals? Our process is one that looks at everything from a year standpoint. So here we are today. We know we want to be at this place 12 months from now. So how do we get there? And a lot of times we're able to really work with your budget and create a plan that is going to be dynamic and really effective at getting to your goals. And we're not afraid to measure it. So we'll take another Visia scan midway through our treatment series and measure where we were when we started to where we are now. And that's really exciting. And I think that's one of the things that I'm proud that we do that, you know, April, that we actually aren't afraid to measure our outcomes. And I think a lot of places, med spas,
I always tell patients it's a great objective way. We all look at our faces every day and we're our own worst critics. And so when we take that subjectiveness away from it, even though you may look great, but we have an objective way to look at your skin and say, wow, like look at the numbers on this, or look at the texture improvement, or look at the color improvement. And it's a great unbiased way to look at things.
So we have a question about what the recovery looks like. And, you know, the recovery is one that involves, and I know that April talked about this, a lot of self-care. And so we teach you how to take care of your face as you're healing. And the most important thing you can do is hygiene. So we teach you how to cleanse your face. You'll cleanse your face 2 to 3 times a day. You'll apply a very special treatment ointment to the skin that helps it to heal faster. That's nectar, regenerated nectar, and also a laser balm. And those keep the skin moist and allow the skin to heal very, very fast. The regenerated nectar helps to boost your collagen and elastin production. And ideally, we start you on that about 2 weeks prior to your treatment to prepare the skin to get ready for resurfacing. It helps to make sure that the dermis, or the deep layers of the skin, are cleaned up, the collagen and elastin production are ramped up and ready for us to resurface your skin. So it usually, what happens is the areas of the face heal at different times. And as it's healing, you notice that new skin is bright pink and beautiful and clean and smooth. And it's really remarkable. It's also that pink color is really important to understand. That's normal. And that will be like that for a few months. And that is very common. So we teach you how to protect that skin, how to take care of that skin. You can put makeup on, etc., usually starting around 10 to 14 days. And your BBLs that we have planned for you after each one of these treatment packages helps to remove that redness from the skin very effectively and very fast. So I hope that helps to answer your question regarding recovery. There's a couple of questions that are about, there's a couple of questions that really focus on specific areas like eyelids as well as mouth. And so smokers' lines is one of the questions, or the lines you get from drinking out of straws. Will those be removed? And the answer is yes, they are. They can be removed, and they do get treated very, very well with Contour TRL resurfacing. With regards to the eyelid area, eyelid crepiness of the upper and lower lids can be treated very effectively with both Contour TRL and profractional resurfacing. And we utilize both of those treatments in that area to help with the skin. Can you guys hear me? I'm getting some messages that it's hard to hear me still.
You sound good from my standpoint.
Okay, good. So one of the questions that we have on here is, how frequently must a patient have each of these treatments to maintain optimal results? April, I'll let you take that question.
So if you're doing the bigger packages with the Contour TRL and the profractional, that's a one-time treatment, I guess. Is that what you're asking? So that can last you years. I mean, obviously we want you to make sure you're having good skincare at home and that you're doing all the things on your part. We're all going to continue to age. But the process is, it kind of goes something like this. We do a package, we do a BBL or a couple of BBLs to help kind of start cleaning up the skin, start cleaning up some of the reds and browns. And then we schedule you for your package, and that's whatever combination of lasers that we come up with specifically for you. And then your follow-up is doing some of those BBLs afterwards to clean up some of that redness. So that's kind of the order of which these treatments go. But as far as maintenance after, we like people to come in and do just a quarterly BBL to help maintain those results long term. But this is not this is an aggressive enough treatment that you're not doing this multiple times in the same year.
Typically, the one that would require a treatment series is acne scarring. So if we're looking at acne scarring, one of the things that we plan around that treatment is doing a deep laser resurfacing and profractional resurfacing simultaneously, so the Trilogy. But we would follow that up typically within 6 to 8 weeks, sometimes 12 weeks, with a second profractional only treatment. And that can boost the collagen and elastin production in those areas, further releasing the scar tissue. That is probably one of the most difficult things that we face when we treat. Is making sure that we're getting an effective treatment, and it does require multiple treatments in order to have an effective result. I have a question here about early promises with various technologies. It's more specifically that things like Cyton skin tidal therapy, they make these promises that they're really going to work, but then they're really end up being very ineffective. And so the question is, how often can we know if one of these treatments is really going to last or be effective if it's early in the product life cycle? And I think in order to answer this question, I'll tell you, therapy is something we never brought into this practice because we did not feel that it was super effective for everybody. Skin tight depends, and it's a tough treatment because it is very effective if you can generate the heat in the skin that's required, but most patients don't tolerate the heat because it's too hot. Cyton's Erbium platform has been time tested and clinically researched to show its effectiveness, not only on vertical rhytids, but also on just overall facial resurfacing. That technology is not new to the marketplace, nor is profractional or Contour TRL, but they are the most advanced laser resurfacing treatments offered in the world of resurfacing today in the United States. So I will stand behind those, that this is not an early product life cycle. This is a very effective treatment, and resurfacing has been around for many decades, starting with CO2. So, we understand these technologies and they do work very effectively. I hope that answers your question. Let's see, we have a question here about basal cell carcinoma and if patients are still a good treatment for laser treatments. That's a great question. And the answer to that is it is safe to resurface the skin if somebody has a history of skin cancers, but the skin cancers need to be treated first. So making sure you have your annual dermatology checks and the skin is clear and free of cancer. It can be a great way to remove early skin cancers, things like actinic keratoses and other precancerous spots, because we are able to get down into the dermis and remove those areas completely by evaporating them or resurfacing them. So I hope that answers your question. Let's see, we have a question specifically about best package when treating necklines and skin laxity, the Fusion or the Trilogy. April?
I'm going to tell you definitely the Fusion, because it has Profound in that. And so the Profound is the one that's microneedling and radiofrequency in one. So we can take that Profound and come all the way down to these, right here at the base of this neck. So if your neck is an issue, we definitely like to have that Profound added on to that treatment.
There's a question about downtime, which really talks about, is this complete downtime or you're able to work from home? And I think it depends on what your work from home life is like. I would tell you that most commonly patients report that this resurfacing, advanced deep resurfacing, advanced laser resurfacing is very uncomfortable for the first 5 days or so. So I would tell you, you probably won't feel like working for those first 5 days or so. Usually after about the 5-day mark, you're able to work from home, but you would not be camera ready. Okay, that would be closer to your 10 to 14 day mark. And I know many people are in the world of Zoom conferencing on a day-to-day basis. And so it is something that you do need to plan for if you're going to have a video presence. One of our nurses that we work with, Haley, always talks about social downtime being a very personal decision. And that, you may choose that you have no social downtime and you basically, after your advanced resurfacing or halo procedure, you go into work the next day. And that's your personal preference. But I would tell you on the whole, most patients for advanced laser resurfacing usually hunker down for about a week and then emerge at that point.
I think another question to consider is a lot of people are asking, can I do individual treatments if I just want to treat my eyelids or my under eyes? This is completely customizable. The best thing I could suggest is come in for a consult. We do those complimentary and we sit down and we say, okay, what's your main focus? Is it your eyes? Is it your face? Is it your mouth? Is it your face and neck? And so if one of these packages doesn't sound like it's, the most appropriate for you, we build out a package that works with you, with your time and with your budget.
I would agree with that. I think a Visia skin analysis and being able to sit down and understand exactly what your biggest concerns are is the best way to create a treatment plan. The reason why we talk about these packages today is that most commonly what we see when we're evaluating skin is that a microlaser peel is a beautiful way to resurface the skin. And we don't have to be incredibly aggressive if we don't need to be. For instance, if someone doesn't have deep lines, we don't have to go super deep with the treatment, which means the downtime isn't as much. But we're always evaluating skin to see exactly what we're treating. So, for instance, if you think about a chemical peel is essentially we apply a chemical to the skin undergoes some damage, you shed that outer layer of skin in 5 to 7 days, and that new skin has risen to the top. It looks beautiful and smooth. Essentially what we're doing with Contour TRL is what's called a micro laser peel. We're evaporating the outer layers of skin instantaneously. We are not putting a chemical on the skin and waiting for the skin to have damage. We're just taking it off. And that's why it allows us to be so precise with your treatment. So when it comes to customizing these treatments and putting them into packages, what we found is that over the course of the last 3 years for us is that our patients want a single treatment that basically fixes most of everything. And the best way that we have in our clinical practice to do that is by combining these safely. And that's why we've created these two packages. So again, I agree with April, coming in to see us for a dedicated Visia skin analysis and then a treatment plan creation is the very best way to understand what combination of treatments would be best for you. I have a question here, April, about Trilogy infusion for African American skin, or patients who have a higher Fitzpatrick skin, 4, 5, etc. What are your thoughts on that?
So obviously, darker skin types, they have more melanin in their skin. So we have to be careful with certain skin types because of hyperpigmentation issues. And so we have laser options for treating darker skin types. So I think it would come down to assessing that patient and seeing what it is that you're specifically trying to treat to see which laser would be most appropriate for your skin.
I agree. Most commonly, resurfacing can be tricky in patients with darker skin type. Most commonly, we will use other treatments such as microneedling, which is a great way to resurface the skin without laser technology, and also consider MOXIE, which is the non-ablative way we can actually really stimulate collagen elastin production, tighten the skin in patients that have darker skin types. It is safe on all skin types, including African American skin, to answer that question. All right. I think there's another question. This is great, actually, talking about making sure we're treating the hands as well. So understanding that we are, primarily focused on face with this discussion today, but the question has to do with really making sure that we're maintaining youthful appearing hands. I love this question because it's amazing. You're exactly right. Face and neck is also chest, face, neck, and décolleté, and hands have to match all of this as well. So April, I know you use a lot of injectables, not only in the face, but also the hands. I know laser resurfacing, including BBL, as well as even profractional resurfacing or halo of the hands, is an awesome way to keep them looking young and youthful and healthy. What are your thoughts on this?
Oh, I love it. That's one of the most overlooked areas that is sometimes a dead giveaway on people. You can have this beautiful face, neck, and you're completely wrinkle spot free. And then you look at somebody's hands and you go, oh, okay. They've had some sun or they haven't done any treatments. And it's a super quick, easy treatment to add hands onto any of these treatments. I love doing hands.
Well, I just want to remind everybody, if there are any more questions, please send them in now. We are, you'll be getting a text after we complete today's call. And we ask that you say yes to come in and see us for our Visia consult and special event pricing. Do you want to review any of that pricing today, April?
Sure. So it's 25% off any prepaid, the 2 different packages that we're offering. The Trilogy package, which includes the microlaser peel, profractional, and the BBL series, with also your post-procedure kit. Regular price was around $9,900. Event pricing is around $7,400. And then our Fusion, which includes all of those things, plus Profound, regular price is usually around $14,000, and event pricing is around $11,000. So we hope to see you soon. And please come schedule. We love to see our patients.
We look forward to seeing you. Thank you all for participating. We hope you have an amazing night, and we do appreciate you spending time with us.
Bye.